Okay, we would start with, I always start when I have to do a full face lifting or a full face rejuvenation. I always start with my fingers on the zygomatic arch, and I try to see where I get the maximum lifting effect from. So in her case, I will take probably this point. You see, if I take this point, I see already a big improvement in the lid cheek junction. I will mark the lid cheek junction now. This is the eyelid cheek junction. This is the nasolabial area, like it's a fold, little fold, it's a triangle here. Then we have this line. Then we have these marionettes. You can see there is shadowing effect. There is some deficiency in this area. Then we have this pre-jowl. I would want to fill a little bit in this area as well. Then as we see, the jawline is pretty smooth, but I want to make the angle more accentuated. So I will mark the jawline, just the border, and I will like to make it more contoured. And you can see I have this area as well in the chin, labiomental sulcus. I want to correct it little so that the jawline, the chin becomes more elongated and the shadowing effect goes. She also has some wrinkles here, so they will improve when the filler hydrates. So first I will mark the different points. I would start with the zygomatic arch, and again with my finger or my thumb I will check where I am getting the perfect lift from. This is the point which looks good to me. Point number 1 here. Then I will inject point number 2 here. As I told you in the cheek, I can also do a different technique, multiple points, like 3 points or 5 points. In her case, I would want to lift this part of the cheek as well, fill it up a little bit and lift it up. So I will mark the infraorbital notch. This is the notch here. So I will inject away from this area. So I will take another point here and inject bone deep and try to lift this up. And after that I will see if I need to inject a little bit here as well. This point will also take care of the tear trough. This is the mid-face point. So it will also take care of the mid-face. Point number 3 is now the tear trough. We will not be injecting tear trough for her. It will improve quite a lot. Then we have point number 4, which is the canine fossa. Point number 5, as I already marked, we call it the marionette line or the shadowing in the lower lip area when the lower lip down turns. Then we have the pre-jowl, point number 6. Then we follow the jawline, go to the angle 1 centimeter above. We try to stretch again with the finger and see the point which stretches the most. So this is my point number 7. And my point number 8 is the mid-cheek region, actually the inferior border of the cheek. Usually between 1 and 2 I will feel a ditch here below the zygomatic arch. So I will inject here as point number 8. So when I inject here, it will be stretching. I will have a stretch here. So when I start with 8-point lift, I usually inject point 1, point 2. Point 1 will be for lateral lifting. Point 2 will be for little prominence and lifting. Then I inject in point 7 and 8. And you see, when I do that, you see the whole, the eyelid cheek junction, the nasolabial, the marionette, and the pre-jowl will improve. You see like this. Then I go to the other side. Before that, sorry, I will inject these 4 points, and when I do this, you see the pre-jowl becomes more exposed because the skin is hanging here. Okay, so when we stretch it, we actually see the real jawline. So here we will inject in this pre-jowl. Then we go to the other side, inject on the same points, come back again and evaluate. Okay, and before doing this, I will be doing threads for her. Again, for threads, for lifting threads, I will make an entry point near the point 1 and put 1 thread here for her. I can put multiple threads. I can put 1, 2, 3. I can be like this. 1, 2, 3, 4. You see, I can get this effect. I can also do it for the jawline. I can make an entry point here, put 1 thread here, 1 thread below, like this, and stretch it like this. Okay, and it will be like this. stretch. But in case, in her case right now, we will do 1 cog thread, we will do some fillers, and later on we will put some mono threads maybe. I will look how it looks, and then after that we will go in for Botox for the upper part of the face. Okay. So we will start now for threads. I have already given her anesthesia along this line. So I will start with the entry point. I will take an 18 gauge or a 16 gauge or a 21 gauge. This time I'm taking a 18 gauge because I have 21 gauge thread cannula, and I will stretch the skin here. I will make the entry point go in. The whole eye of the needle goes in. Are you okay? Comfortable? Yes, she's okay?
Okay, Mama.
Yes, yes, perfect. We wait for this needle for about 20-30 seconds so that we are not in a vessel. If we are in a vessel, the blood will come out, and also this hole, it becomes a little bit bigger. So we will take this out. Okay, not so much bleeding. We will take the gauze. Clean it up. Take the thread. We need scissors also. Scissors.
Scissors?
Yes. So we will enter in the fatty layer and then just move around carefully. Yes, up till the nasolabial fold. You see I'm here. Then we take it out. Perfect. So when we are in the right plane, in the fatty layer, the thread will, the needle or the cannula will go in very smoothly. And you see this cog, we are pulling this. Can you see? Can you appreciate? You ask them, they're appreciating. We see a pull here. You see this pull? Yes, now we stretch it and we go down, down, little bit more down, and then we cut it. Okay? Make it like this here. Now you see this is a stretch here. So now we will stretch it, massage, so that the tissue expands. Okay? Now just clean it up. Sorry, are you comfortable? It's okay? It's okay? Yes, perfect. She's totally fine. We had given local infiltration here, and
she's very quiet patient.
Yes, you see immediately you see there is some difference here. We get a nice contour here, and this becomes a little bit more shallow. Okay, just with one thread. She needs just one thread right now because she has a good skin to begin with. The distance between bone and skin is less. She has good collagen. I see it's good collagen. She has very less tissue. She has more wrinkles, yes, but the quality of collagen is pretty good. So I will put another thread on the other side, and then we will start with the 8-point lift with the filler. And as you can see, the patient is very comfortable. She has no problem, and I want to clean this up, and I want you to see, especially this cheek has contoured now. This is on a higher plane, and this looks thin. Can you focus on the full face? Yes, so that they can. I will clean it up, and they can see the difference. I will clean this up. Can I have spirit?
Yes.
Yes. Thanks. This is with the spirit?
Mm-hmm. No, without.
Okay. Can I have spirit also with this, please? Mm-hmm. Yes. So I will clean all the markings for her so that you can appreciate the change which has happened. We have got like a lifting effect.
Alcohol?
Yes, alcohol, yes.
Mm-hmm.
Thank you. I will just clean up. And we will mark again. I just clean up because you can see the difference between both the sides. So you just finish, yes. See now. You see the cheek position of cheek is down here, it is up here, it is more contoured here. Even when you stand behind, you can make the difference. Come and see behind, from behind. Have a look from behind.
Yes.
You see this is lifted up and this is on the lower side. So one thread is enough. I will make it with fillers now. Yes,
Okay.
but I will do the other side as well. So this is my raw lifting, my rough lifting. Also, I have put a thread because I want her to have her own collagen to regenerate. So this thread is pulling right now, but also it will help to make new collagen in the future. Slowly, new collagen will form around this line. Okay. Now I go to the other side. On the other side, I have a vessel here, superficial, so I will change some position of my thread. While I was giving anesthesia, I could see a superficial vessel here, but it's all right now. It was bruising just a little bit. Now I will take the entry point needle. Yes, this one. Yes, thank you. Thank you. Again, I will the whole eye of the needle will go inside. I feel a dip. This is very important to feel a dip. Feeling a dip means that I am in the fatty tissue, okay, the fatty layer, the facial fat pad, and my thread must be in this tissue. And I wait for about 20 to 30 seconds. Then take it out. There is no bleeding here. You have to be very careful also. Sorry, leave it there, no problem, leave it there. You have to have a good lighting system so that you are able to see some superficial vessels, you know, and you see them, just try to be away. We have this entry point now. Can they see this? It's yeah, okay, yes, my friend, is yes, okay. So I will now enter, yes, and the fatty layer, smoothly. See this, you see the lifting? Yes, can you hear, can you ask, can you see this? Yes? Yes. So we will again take the scissors, lift it. Okay?
Okay.
Press it down, cut it. You see the stretch here? Yes, we massage softly. Take the stress out of this. And usually with this thread, we can get a lifting effect of about 1 centimeter. So that's a realistic goal. Little bit less or more. You see now, you see immediately this becomes more smooth and more contour. Okay. Now we will clean her up nicely. Can you make this?
Yes.
Yes. So this thread can be, we can use like 3 threads or 4 threads. So one would be here, one would be, I will mark again so that you can see where all we can put it, this cork thread. So I'm not putting in her because I have to put fillers as well. She's a good enough case to show everything. So this was the first one. The second one I can put like this. Third one maybe like this, and lift it up like this. So my point 1 becomes the anchor point. Okay, and when you are more experienced, or the surgeons can also take entry point, they can take long needles, take entry points from the hairline or inside the hair in the temple area, and we can use longer threads and tie a knot here. So when we pull all of them together and tie a knot here, this stays in the hairline, so it does not show. When I take entry point in this area, I usually avoid to make knots. If I use multiple threads, I can take them, tie a knot, but it can become like a small raised nodule. It can show here. But if I do in this area, in the temple, or in the hairline. This knot can be, you know, it will not show. So it can have a more massive look. So I can lift from here, this part. So I can use some threads like this and some like this. So 3 or 4 here, and that's good enough. Since we would be using also fillers here, so I'm not using many threads. These threads will lift like this, and also for jawline. Suppose when I have to do only jawline, her jawline is good, and you know, we don't need to do a lot. But if I had to do a jawline, I would make one entry point here, one entry point here, take it straight like this, take it straight like this, stretch it, lift it up, and then fill in 0.6 and in chin, and it will be like a perfect jawline. We would be working on her jawline, but with fillers now. Okay, so threads is done. Any questions regarding threads? So I can move forward for my filler injections. Okay, no questions?
Latency.
Later? Okay, they want to.
No, latency. We need to wait for it to live stream there.
Okay, okay, no problem. Yes, yes.
Все окей? Нищо не боли?
Okay, we.
Не.
Нямаш само да питам, имам питане за него. Човече, я имам питане неко за него?
Okay, we will wait for them to ask if they have a question.
Okay, continue.
No question. Okay, okay. Now we will take a thick filler, and I will use my thumb or finger. I will stretch it just around 0.1 because I found it as a good lifting point. Feel the bone here, the zygomatic arch. I will enter here, feel the bone. Slowly, slowly, slowly inject the product. Come out, no bleeding. I will massage it. You're okay?
Okay?
Yes. If she ask her if she has problem, she tell me. Okay.
Ако нещо буде, имам.
You see now, we inject in 0.1. Okay. Now you see when I inject in 0.1, you see the contour of the cheek. The lateral lifting, we have a lateral wall to the cheek and a nice curve. And although we are injecting, but the face is looking thinner because I make it lateral lift and in the curve. It's called as curve of OG of the cheek. So cheek has 2 dimensions. This is the highest peak and this is the curve. When I inject here, it does the lifting part. Now I will inject in point number 2, which is the most prominent point on zygomatic arch. So I will give anterior prominence to the cheek. The cheek will come forward. So this is the most prominent point in the cheek. I will go inside. Feel the bone. I am on the bone right now. And slowly, 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 I will inject. Perfect. You will see that the product comes up. You see the difference between this and this. The product is up. We have anterior projection of the cheek now. You see this? Now we have a very nice curve. Anterior projection and lateral lifting. Now, as I told you before, cheek can be divided into 3 points, 5 points, 4 points, depending on the area of deficiency. Okay. So now I will take another point here, this point. This is a little bit deficient point. I will again feel the infraorbital notch, which is here. So I will stay away because the nerve is here on the bone. So my next point will be like this. I will enter here, feel the bone, relax, yes. Now I keep my finger here like this so that it comes up. I want the cheek to come up. Very slowly I will inject, slow about 0.3 units, come out, keep it like this. Now massage up. You see now, you see the difference? Just see the difference between both. You see this? Yes? The difference? The cheek is up now. It has like a nice contour. Yeah, this cheek has little bit depressions here and they're not smooth. This cheek is so smooth now. Very smooth. Now, I will look her from the front. I want to do little bit here also. Okay, this part. So it will be like a 4-pointer. This is the notch. I will go inside here, sorry, just feel the bone, always on top of the bone. Very slowly, slowly inject, bring it up. The secret here is when I'm injecting the cheek, I have to inject on the bone. My needle should be on top of the bone, because in this case, I'm not saying that, you okay? Yes, I'm not saying that I cannot have bruising. I can have bruising, but since I am on top of the bone, I will not inject inside a vessel. This is more important. So I will clean this up, nice and proper. You see now the difference between both cheeks. We have good prominence here. We will massage her. You see now, smile, 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 smile. You see this. See the definition in this cheek. Nice contour, nice lateral wall. So we did 4 points for her cheek. And the cheek is coming up. We have made more definition for this cheek. Can you make out this definition here? The cheek has good lateral projection and the anterior eminence. It is anterior projected. Okay? Now we will inject in point number 7. Point number 7, I told you I will feel the jawline, I go to the angle and I go superficial. It's thick filler but superficial. So I will be here and I will fill this area up. Very nice. See the product here? The product is outside. Now I will massage this and push it back, and you will see that there is more definition in the jawline. Okay, so we have done point 1 and 2 and 2 additional points for the cheek. Point number 7. Now I will take a new syringe and I will inject in point 8 and then in point 6. So I will
What you need?
gloves, man. Oh, that one.
Okay.
Okay, now I will inject in point 8. Point 8, as I told you, will be in between point 1 and point 2, the below the zygomatic arch in the depression here, and I will enter very superficial up here, inject a little bit of product. You see the product here, I will massage. Again, point 7 and 8 is superficial. Now we will go to the jawline, and you see I use my other hand. I will hold it with my finger and thumb like this, inject, feel the bone and deposit very little material. She has a good jawline to begin with, so I am not going to inject a lot, and I will massage on top of the bone. You're okay? Comfortable? Mm-hmm. Yes, very good, very good. So now we go to the other side. Again, I will inject. Can you hold this, please? Make it more clean. Just clean it up. We have a very nice patient. She is very cooperative. Feels so good to work like this, you know. So just clean her up for the injection points. Again, I will take point 1, but here we have a vessel, so we will be Can you, it's visible? Yes? Okay. So, it has little bit, bruising here because when I was injecting local anesthetic, I could see it came up, became a little blue, but okay. So I will stretch again, go feel the bone. Perfect. Come out, massage slowly. Then I will go, can you look this side please? Yes. I will inject point 2, which is the most prominent point. Feel the bone. Inject a little bit. Massage. Again, I will feel the infraorbital notch, just to be careful. Slowly inject. Perfect. You see, I am always on the bone. When I am injecting in the cheek, I am always on the bone. This keeps me safe as well. Also, I am using a thick product, so I will not have any crumbs. I will not have any nodules afterwards. So it will be deep. It will hit the bone and it will come up. So it will make like a ballooning effect. Okay, and you see when you inject, you see the filler coming up. If I am not, you see I am not aspirating. If I have to aspirate, I will go hit the bone and I will keep my needle exactly at same place, not move it, exactly at same place and then aspirate. If while aspiration I come out, then the whole idea of aspiration goes wrong, because then the aspiration would be for that particular depth. So I am always on the bone and there is no need to aspirate. I do not aspirate. But having said that, I am not saying that you don't aspirate. This is my experience. I don't aspirate when I am on the bone. I am not asking you not to aspirate. I will feel the notch again here. And can I look here please? Yes, perfect. So inject, stretch here, slowly, yes. Feel the bone. You see when I inject, you see the product is coming up. You see the product is ballooning up, slowly, slowly, slowly. And I come out. Can you hold this please? Yes. So we did the lateral projection. And now we are doing the anterior eminence of the cheek. So we have a very nice cheek contouring. The cheek will come up. Yes. Now I will again go to point number 7. This will bruise a little bit. I will tell you what to do about it, okay? When I put the anesthesia, you know that back. Yes. Okay. So we will feel the jawline angle 1 centimeter above here. So I will go inside but be superficial. See, like this. And inject slowly. Come out. You see the product here? And I massage, take it back. You see, it's gone. Jawline is stretched. Now we'll go point number 8. It's here. Go inside, come up. Inject slowly, 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 slowly here. Massage. Now I will inject. Okay. You see the pre-jowl, there is little bit. I will hold with my thumb and finger. Inject like this. Hit the bone, feel the bone. Perfect. So we used 2 syringes, 1 on each side. Now I will do some balancing job. Clean her up. Perfect. Now I will take a medium filler. Okay. and I will inject in point 4, which is the triangle, canine fossa. And you see, I will inject deep there. I will go inside. Sorry, just relax. Feel the bone. Fill the product. Point 2 to point 3. I can see the product comes up. I come out and I massage like this, in this fashion, like this. Now I see a line here, so I will correct this line now. I will not inject superficial in this area, so I will stretch it, go inside, sorry. Again I will go, sorry, just relax, sorry. So we are almost 70% gone, and this filler will hydrate. I don't want to put more. This will hydrate and it will stretch. You see now difference? Mm-hmm. Yes? Mm-hmm. This has come up nice and we have filled this up, but we will not do more, okay? This is enough. She will hydrate after this. Now we come to this side. Again, I will inject in the canine fossa. Sorry. You see the product is coming up. We stop here. Massage like this. Perfect. Then I will follow this line. Sorry. This hurts a little bit. I'm so sorry about this.
Okay?
Yeah, she's fine. Yes, perfect. Very brave woman. See now, you see it's a big difference now, yes? But we will leave it now because it is going to hydrate. After 3 weeks, it will take up water. Slowly it will take up water, and okay. Now we will take 4th syringe and now I will work in this area for the labiomental sulcus. Do we have any question by chance? Or they want to watch first? They want to watch. We wait, okay. Okay, good. Yes.
Very good.
Yeah.
Can I clean this?
Yes, ma'am. Thanks. Thank you so much. Thank you. Boris, take this also. Please. Okay, he's.
If anyone has questions, ask again.
Should I continue right now, or do you have any questions? You feel okay? Good? Yes? Yes?
Okay.
You're a very brave woman, okay? Like, yes, bravo. Yes.
The last we will continue.
Okay. No questions means 2 things. It's very good, they understand everything, or I'm not so good at all, you know. No one understands, yes? Okay, so we will take this line, the labiomental sulcus, okay, and I will enter here and start to inject slowly. You see now we have some improvement, and I come from the other side now. Slowly we will inject so that it gets chance to expand. Now I want to fill this little bit more, but first I will do this now. Point number 5. You see there is deficiency here. So there are 2 ways to do it. I can also do, can you open your mouth? Open. Yes, I can, more. Yes, I hold it like this here. Yeah. Turn like this. Okay. I hold it like this. I will enter here and I give a bolus and massage. Goes? Good. It comes up, see. It comes up. The line, the lip comes up. Now I see the fold, and I just measure it like this with the needle, and I enter here. I inject slowly, inject here. Massage. Sorry, I will push, okay, little bit, yes.
No, it's okay.
Yeah. Because I need to spread this, yes. Okay, this looks much better now. If you compare with this side, this looks more shallow, this looks better, yes? And we will not do more, we will let it hydrate. This will hydrate, become tight. See, the lip comes up here. You see this? And this we have depressions here. This is better now. Yes. So we will do exactly same on this side. I will give, can you open? Yes, open. Go inside, give small bolus like this. Okay, okay, comfortable? Yes? Just 1 second, I will clean. Just, can I take 2 minutes break, yes? 2 minutes, yes? Okay. So I will now, I have used 4 ml, okay. Now I will do a little bit balancing for her with another syringe, okay. And come, can you look from the front, please? It's about symmetry. You want me to put little bit here, or just have a look close by and let me know. So we will balance it now, and we will also balance little bit lines here, small lines, so that we are finishing. Yes, yes, okay, okay. Just see, just have a look and let me know what you feel about this. Or maybe ask her, we have a mirror?
Yes.
Yeah, just give her mirror, yes. So we will balance it for her now, okay?
Sada ćeš da pogledaš i ako misliš da negdje treba da se izjednači. Znači pogledaš kako izgleda.
Sorry.
I ako misliš da negdje treba da se izjednači.
I'm sorry. Can you please? Yes. Thank you.
Ti ne vidiš nikakve asimetrije?
Pa,
Ajde.
mislim da ne, možda malo jače ovdje, ja? Ili ovo bledo ovdje.
Wait. Now I'm asking my client, show her mirror, and asking her if she feels about asymmetry in the cheek or any part of the face. Because now I will be doing the balancing part, okay? And she is explaining me, she's explaining the doctor in her language, and he will explain to me. Yes.
Znači kaže mi, da li misliš? She think this side is a little bit
bigger. This is less. So I will inject a little bit more here.
Znači misliš da je ova strana malo jača?
Nije, čekaj, mislim da je oba malo jača ili je to natečeno sada?
She think this side is a little bit
bigger. This side, yes, and this side is less. Okay. And where she thinks like this? Which part?
Gdje misliš da je jače? I da li si sigurna?
Mislim da nisam sigurna.
She's not so sure.
She's not so sure. Okay, so I will do what I feel like. And we must also know this, that because we have also given her anesthesia along this line and given her thread, so there is little bit more inflammation. So she must not worry that it's too much right now.
Okay.
It will subside, the inflammation will go, and then it will contour. Now I will make estimation myself. Okay, I have asked her, she thinks she's not 100% sure. It's little bit mostly balanced, but we will correct little bit asymmetry, because as we know that all of us have little bit asymmetry. So even if I'm putting equal doses on all the sides, still the patient can feel little bit more asymmetric. Okay, so now I will balance. I want to do little bit more here, and I will cross hatch it now. I was going straight because now I want to be like this. Sorry, to fill this up. Now it's quite better, yes. Now this side as well. So I will cross hatch because I want to bring this tissue up. Like this. Like this. Sorry, feeling okay? Yes, yes. Little bit more here.
Yeah, I think this side is a little bit bigger.
This side is small. Okay, okay. So we will.
That's my opinion.
Yes. Perfect. I see this myself. Now I will enter here. See now. Little bit more I will give here, yes. Now you see our lip, it comes up, it's not falling down. The shadowing has become very less, okay? And I will also give like a small bolus here in the center, small mini boluses to bring this up. Hold this please. We'll take a gauze. We will also request Dr. Boris to send her picture, once she finished, like after three weeks. So we will see like a very shining bright face. Yes, this is what we do with facelift. She will have a very nice rejuvenation, and because the filler attracts a lot of water, so she will have a glow on her face and a lot of rejuvenation. So people will ask her, what have you done? But they will not know. Yes, yes. It will be shining. So I am just cleaning her up and looking where I feel there is little bit deficiency. I feel it's good. You see these lines here? I will fill little bit, these lines, yes. And then little bit that is left, I will check the cheeks, okay, how I feel. Okay. I feel it's almost equal, but we will see, yes. So you see this line here? I will just quickly fill these lines up a little bit so that she's more fresh. So that they become little bit less, these lines. Sorry.
Okay.
You feel good? Yes? So much better now. This side is better. This one we will do more. This part. Sorry. Okay, so we have used 5 ml total, and it's enough. 1 thread each on both sides. I will now massage her, because I need to massage the filler nicely so that I don't have lumps. And we will just, after massaging, we will do Botox for her, for forehead. You look in the mirror, please. Show her mirror how she feels now. How she likes it, on how much. You like? Yes. Now we will do hair, okay? This part, yes. You see, nice rejuvenation for her. It will improve a lot. Yes. This is little bit swelling because we had some bruising. You know, hair vessel. I told him. Little bit bruising is here, so it's little high. Yeah, I will. Yes. I will press it, okay, as much as I can. Sorry, I will hard. Yeah, but it will take 2, 3, 4 days to settle down. Yes, yes. So, do you have saline? Saline? Normal saline?
No.
Normal, yes. Normal saline, if you don't have, I will have a heart attack. How will I do Botox? No, saline with the, which you use for bone grafting sometimes. Yes, saline. Good? Feeling good? Okay, good, nice. Everything okay in the people? It's okay? Yes? Okay, perfect. We'll take 5-minute break, okay? We will just take 5 minutes. Okay, no problem. We will run in. Can I show, where is this hair? Yes? It's okay? Showing now? So, I have 100 units of Botox. I will take 3 ml saline as recommended. And you see this goes itself inside because it's vacuum sealed. So, if it doesn't go itself, it's... Yes, and now I mix it, not like I don't shake it, but I mix it like this. I just revolve like this. That's it. Okay, now I will do the markings for her. Oh, sorry. Sorry, they could not hear it. No, whatever it is. Okay. So I mixed 3 ml saline in the Botox, and it's right here. Okay, now I will keep it here. It's ready. Now I will do the marking. So there are different ways of injecting forehead, and different people have different techniques, different marking points. What I do is I ask the patient to look straight ahead, open the eyes. Straight, yes, yes. And I mark the lateral limbal line here, lateral limbal line here, and 2 centimeters up, I mark a line here like this, extend it, so I make 8 squares and 2 units Botox in each square. And I ask my patient if she wants an eyebrow lift on the lateral side. If she wants a big lift, I will not inject here. If she wants little bit lifting, I will inject 1 unit here, 1 unit here. And if she wants the same size of eyebrows, I will inject 2 units each side here. Okay, this is for the frontalis. Now for the crow feet, I will mark the external orbital ridge with my finger. This is the ridge. 1 centimeter outside, I will mark a point. 1 centimeter below, 1 centimeter up. And I will give 3 units each here. Again, same here. I will mark the orbital rim here. 1, 2, 3. 3 units each. Now I will make her frown. Can you be angry? Angry? Yes. This is the procerus, and this is the bulk of corrugator. I will mark 3 points, and I will give 5, 4, and 4 units here. We can also inject for under eye, and we need to select the patient well. I will check it. We do a snap test. We press it like this and leave it. If it takes some time for it to go away, we do not inject. Like in her case, it takes some time to go away. You see, 3-4 seconds. So we do not inject under eye. If it goes away quick, like in my case, they see me here in the video? If I do like this, it goes away quick. So I can do for me. It can be done in my case. Okay. So I will fill it up. So I will put, in her case she wants an eyebrow lift. Yes, she wants eyebrow lift. Yes? She wants it, so we will do like this. Now inject 16 units in the forehead, frontalis. It takes some time for it to come out. So we take the air out and I bring it to 16. Perfect. Now we take spirit swab to make it sterile injection. Okay, now we start from here, stretch it. Sorry, it hurts a little bit. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. So we have 16 units here. We will not massage. Let it be just, we can press lightly because the Botox tends to spread 1 centimeter square. So that is why we mark the safety zone. This is 2 centimeters above, and again in the center I have injected. So there is no possibility that the frontalis muscle here will be hit and it will come down. So we are in safe zone. That is why we do this marking. Okay, now we will inject the corrugators and procedures. I don't want to make it very plastic look on her face, so I will inject 5 in the procedures and 3 and 3 in corrugators. It will give a very natural look to her face. So 5 plus 6 would be 11. So I will take 11 units. Maybe put 12 and then take the air bubble out. But she's okay with this. Yeah, I will not take 100% out this. Just a little bit will be left. Okay. It looks good, man. It's natural, you know, more natural. So I will take 11. I have 11. Okay, can you make angry? Yes, angry? Yes, I will inject now in the go deep procedures. Straight. 1, 2, 3, 4, 5. Stop. Can you make angry now? Yes. More angry? Yes. Yes. I take my 1 finger and thumb here like this, and I enter like this in the muscle. I give 1, 2, 3. Stop. Come out. Very good. Just keep it like this. Can they see like this? Can they see? Yes.
Move ahead just a little bit left if you can.
Left?
Left. No, that's right.
Yeah? No, man. Let's not risk it because it can make a problem. Okay?
Yeah.
Yes. Okay. Yes. Finish. Now I will inject 9 plus 9, 18 units in the crow feet. It takes some long time to take out. Yeah. Yes.
Well frozen.
Yeah. So I will actually do 4-4. It will be better because she has strong. So 4-4, 12. This will be better. 12. In this case, what I do is I will inject away from the eye. So away. Now for the upper, I will be down like this. So I will go in. Sorry. 1, 2, 3, 4. One, 2, 3, 4. 1, 2, 3, 4. Again for the other side, 12 more units. Okay? Yes? Yes. Again, I will be away. So this top injection would be here. Okay. So we finish. We will clean her up nicely. Not press too hard. Massage nicely once again, just the final touch. Ask the patient how she feels and
Yeah.
yes, good, good, feeling good. Yes, she is very nice patient. She was very cooperative and she will get a very good results. Now has also, but it will be much better. And do we have any questions now? So that, yes, I will, you have, okay, I will quickly change, okay? Change. This is better for you. It looks more cool. You know, nice cheek. Yes.
Sorry, what is about, kako se kaže period oporavka, što treba da radi?
No, the eyebrow will go up. See, the eyebrow here, it will go up a little, like this.
Okay.
Little bit, okay? Yes.
So what she need to do?
Post-operative.
Post-operative.
Nothing, not be like this.
Aha.
Not be in steam sauna, no, 2 days. Okay. No, less coffee, less tea. Okay.
And alcohol.
Alcohol, of course.
Ne piješ ti, ne smiješ kafu, cigare, ništa što bi...
More water.
Malo da piješ više vode.
Juice and everything. For 2 days, no problem after that.
Okay.
Yes?
To je to. Možeš da ideš malo četiri.
Odlično izgleda.
Da.
No, just injection, no threads. You just like this, see?
A ne znam što se ti...
So nice it
Ovo
will.
me ne vjerujem.
Ti možda samo
Ali vidiš, on kaže ne da puno nego
da to zapiješ.
Yes.
samo tu injekcija i onda bi mi kao bilo prirodnije nego da pupunjamo malo da budem
Ja,
ponavljena.
mama.
Da, ja znam.
Thank you.
You can add by Instagram or Facebook.
I don't have. They also criticize me, but I don't have. Boris has.
Boris has it, yes.
Yes.
So you can contact him. Okay? I will be here next time maybe. But I need to go.
When?
I will. It's always on my Facebook, my program, and Instagram.
Did he?
But he's on. See, it's like this. My Facebook has program. You know, full program.
Perfect. Thank you so much.
And you have the date when you
Professionals.
In which clinic you
I'm working on around the world.
around the world?
Yes.
Okay.
I now to
Let's
Sweden.
get the conference over.
Okay.
We can breathe.
Yes.
Going to Sweden, and then Stockholm, Karlstad, Oslo, Bergen. Then I go to Moscow. Implants conference there in Moscow. So I'm talking about Botox or implants like bruxism and gummy smile.
Bruxism and gums are very interesting.
Yes, Botox and lip repositioning I do with laser.
Because I am a periodontist and we do gummy smile with
Crown lengthening.
crown
See.
lengthening and
With lasers. Crown lengthening. This is
yes.
before. This
With laser.
Yes. With
I do with knife. Everything.
And see,
You can
free
use
gingival grafting with laser. Biopsy with laser or some mucous fibrosis.
Which kind of laser do you
I have
use?
one. Albumia diode. Two diodes.
Which diode?
980 and 808. Okay, I show you gummy smile.
Which kind of filament do you use?
Global Biocare.
Nobel. I work with
Yes.
with
Nobel
Nobel
Access.
is the best. Yes.
Yes.
it's an Israeli invention.
Yes.
Yeah.
Alpha Biocare.
Alpha Bio.
I am working with Alpha Bio. Israeli.
Alpha Bio.
And
It's 5 minutes away from my home.
yes.
Yes.
I will show you now gummy smile. See this.
Da, oni su radili sa laserom.
See this gummy smile. Yes. And
Crown lengthening, like we do.
We have one...
without any bleeding.
No bleeding, yes.
Yes.
But post-operatively, do you have a recidiv
Sorry.
with laser?
See this chin implants I also do. You can also do chin implants, and this is how it looks like. Wait.
Oh, it's very nice.
Wait, one second.
This is our gummy smile. We do...
Nice, very nice.
Veneers.
Veneers. Very
Veneers.
nice, very nice. See this case.
Botox for you.
Yeah, I first put Botox for gummy smile.
Botox for gum.
Just because it can relax.
Da, to sam ja gledao. U botoksira ove ovde
Look at this.
nerve.
Oh, cheek implants.
Yes, cheek.
It's very
Yes.
nice.
Yes, also do fillers here.
Oni rade, gledaj, on botoksira ovde, padne,
Okay.
i padne, ali radi crown lengthening i... Da.
Of course, if you give me the
Nerve, nerve gluposti, ona već kako
for enough technician,
Si radila te nešto? Jesi?
we should ask for it.
Samo ovo što sam ovdje.
A ništa nisi, to je super.
I can send you photos of
Ne, ja
I need your email.
Nisam ja.
Should I clean this or something we have here? You can clean it. Or I can help you.
No, leave it like that.
Okay.
Our assistant will.
Okay, thanks.
And I name
No,
Jeste.
and email.
šta? Stresno me ti se toliko stresiraš ako međuljudski odnos.
Great. I'll work on the photos
Yeah.
and send it to you.
Yes, no worries. Ti si super.
You can give them, yes? This?
Yeah.
Boris, you can keep this match.
Yeah, really?
Yes, yes. You can use in masseter maybe.
Really?
Yes,
Yeah?
yes.
When you're doing implants with immediate loading, you can relax the masseter a bit.
Yes, it's about, I put in her 16 plus 5, 21.
How long
Plus 6,
can it stay?
24
In a
plus
fridge.
24.
Yeah.
It's 52 units still there.
Okay, but how long can
1 month at least.
1
It
month.
can stay. But it
For me.
sure. Yeah, for you, you can do it. Yes, yes, yes.
Can you do?
You want me to do now? Okay, sit quickly.
Do you think that I need
I don't have to do so much for you. Like you understand? You look beautiful anyways. But if you want to do, I can do. Use it in masseter. It will be more helpful for you.
masseter?
Not for you, I mean for patient. Yes, yes, yes. But you don't, like if you
Okay,
ask me,
okay.
and because you're a colleague, okay, you're a doctor yourself, I don't prefer, okay? This is
Okay.
okay, you look okay. That
Okay,
way. Yeah,
okay.
I can do little bit this, like you, maybe this, but I don't want to touch you. For her, I can understand.
Mhm.
No, she needs. You don't need.
60 years.
Yes, and she has good skin, very good skin. She has.
Yes.
Doctor, just to ask, what she can do with...
Threads we can do. I have no problem to inject you. Please understand.
Okay,
It takes 2
yeah.
minutes.
I understand.
Yes, I can do it if
But
you want.
I listen to your
Yes, advice. Okay, okay.
Yes.
What she can do about...
There are some threads here, mono threads, small threads.
Mm-hmm.
Or also, there is one technique to make filler. Very fine filler, little injection, and then do.
Isto može da se radi. Mi ćemo da radimo onda.
If I come to Belgrade next time,
Okay.
maybe I will message you
Yeah.
and I will make her model, okay?
Okay.
And you also for this.
For this.
For this,
Yes.
yes.
Okay.